So in this video, we will talk about the Netra dhara or Netra Sekam. This is mainly for the toning of the eye, like some overuse of the muscles of the eye. So the looseness or the fatigueness of the muscular muscles of the eye. So for that, when you are pouring a continuous pouring of that medicated kasaya or thylam or mixed with that both or any dhanyamla dhara, dhanyamla mixed with that, the continuous we are pouring on the eyes. So for by this procedure, so many medical effect we are getting. For one eye, we are using some matra either for 400 matra, 200 matra, 600 matra according to that patient condition. If roga and rogi wala is too much, so we are deciding according to that. And generally we are doing 20 minutes. So this is very simple procedure. First, we have to lay down the patient in that comfortable droni or any table. So we have to first put a cotton ball in the ear. If any leakage will be going in that ear, so for prevention of that we are using. And we have to take 2 glass of medicines like kasaya, thylam, or mixed with that dhanyamlam. According to the condition of the patient, we are doing like this. And then 1 glass we have to pour that in that canthus, medial canthus, continue for that 5 times, and next eyes also for the 5 times. So after that we have to wipe that kasaya and all, and just leave for that for the 5 minutes, and take the rest, tell the patient to take the rest, and don't go suddenly, don't go to the bright light, just wear the black glasses for that. And in some indications are there, like here what we are using, that is one endamula, punarnava mula, trifala, and dhanyamla. That this is the used in the condition hypertensive retinopathy. And there is one other case in which we are using st madhu kasaya, that Krishnan Mila, that we call dry eye, and Darvi Manjista Dhanyamlam, NPDR, and another patient have low in that he have distortion of the vision, in which we are using Lodra Manjista, Darvi, or Usira, and we are using 20 ml of that Patoladi. There are some other conditions also where we can use this procedure, like conjunctivitis, watering of the eye, foreign body sensation. That's it. Let's see the procedure. First we first we have to prepare the kasaya and mix in appropriate proper amount. This is a different thing. We have to add 1/4 of dhanyamlam. It's not a fixed thing. We can change according to patient condition and situation. So out. You have to put cotton. If any leakage are extra, we go. So didn't put go in the ear. Oh, ear.